Welcome back to Great Day Houston. It used to be if you suffered from uterine fibroids, the ultimate answer was to get a hysterectomy. But today you can get rid of the problem and hold on to your body parts. And here to show us how, please welcome Hardee, Dr. Eric Hardee with Houston Fibroids, and Brigid Davis, who was treated for uterine fibroids. Good morning.
Good morning.
All right, so a lot of women may be suffering through it right now because they saw what their moms may have gone through, and that traditional way of taking care of the problem was to get a hysterectomy.
That's right. Open hysterectomy has been the gold standard for many years in treating ladies with symptomatic fibroids. But it is an open procedure. It works very well, long track record, but some ladies just don't want to have surgery, don't want to have the downtime, don't want to miss work, don't want to have a big scar in the abdomen. So in ladies, particularly ladies who are through having children, there's another option for them that started around 20 years ago. It's becoming more popular now, where instead of having a surgery, we do a vascular type angiogram procedure where we insert a tube into the artery and guide it toward the uterus and inject these tiny particles that flow downstream. They shut down the blood supply to the uterus, and the fibroids shrivel up and the symptoms go away.
The fibroid almost has a life of its own, doesn't it?
Well, not anymore after we embolize it.
You shut it down.
Yeah, exactly.
You shut it down. All right, and so we're looking at kind of an example right here. So there's where those fibroids are. What are fibroids and what causes them?
Fibroids are benign tumors, meaning they're not cancer. They originate from the smooth muscle cells of the uterus, and they grow in these large balls. It can be the size of a grape. Some grow to be the size of a cantaloupe even. When they grow inside the uterus, they'll cause symptoms like very heavy menstrual bleeding. They'll cause pelvic pain. If they get large enough, they can press on adjacent structures like the bladder and cause urinary symptoms.
Yeah, and Bridget, it just becomes one of those things that can just take you to your knees at times, right? Like literally missing work, all that type of stuff. And so when did you first notice you were having some issues, and did it get worse over time?
Yes, it did get worse. I was sick. I gotten real sick. Cycle-wise, menstrual cycle, it wouldn't go away. It'd stay on for 2-3 months. A lot of bleeding, a lot of fatigue, tiredness, and I went back and forth to the doctor, and then they found I had a bladder. It was pressing against my bladder. My bladder kept having to use the restroom lots and lots of times, back and forth.
So besides being inconvenient, it just made you feel really bad.
Yes, I was always fatigued. Yes, I was feeling bad. I was always having heavy bleeding, lots of time where my cycle wouldn't go off, and yes.
And then oftentimes there are women who think they're coming toward the end of that cycle period, and then all of a sudden it's like, here it is back again with a vengeance. Is there a certain age that this happens more for women?
Well, by the age of 40, about 40% of women will be diagnosed with fibroids. That's all comers. It's actually 3 times more common in African American women. Up to 80% of African American women can experience fibroids at some point in their life. The most common age groups we typically see are age 35 to 50, I mean.
Okay, and then when that happens, it almost like we were saying, it almost has like a life of its own. It attaches to the uterine wall, and that's where
it grows in the uterine wall, and they continue to grow until you hit menopause. The fibroids will grow larger and larger, and the symptoms typically get worse.
Okay, so when someone comes in, is that the first course is to go ahead and address that, or is there like hormone treatments? Are there other things that you can look at?
There's other medical therapies.
Are they just kind of...
Patients can try birth control pills. Some patients can try an IUD. But once the symptoms are not managed with medical type of solutions like that, then the options patients are presented with are typically hysterectomy, and in ladies who don't want to have surgery, this is another option for them.
Yeah, all right, so the UTE procedure, the great thing about that, again, of course, is that your downtime is not what it would be like with a typical hysterectomy.
Well, if you have a hysterectomy, if the uterus is small enough, you're able to have a small horizontal incision that can be hidden by a bathing suit, but if the uterus gets very large, you may have to have a vertical incision, and any hysterectomy, you're looking at several weeks of downtime, even up to 4 to 6 weeks. When we do the uterine fibroid embolization procedure, actually ladies go home the same day. You don't have to stay in the hospital. They come in our office at 8 a.m., they leave by 1 p.m., and they usually are back to work in a week or even less.
All right, so you're nodding your head and you're going, that's true, that's true. Did you put it off for a while, and why?
Well, I kept putting it off because I had other issues. So I was referred to Dr. Hardee, Dr. Fox, thank God for them. And they the one, he gave me the great idea, well, won't you do this? And I'm like, okay, I'll do it. And I actually had to say, God has been so good because I've been great since I had the surgery. You do have cramps after the surgery, but you have.
I'll put up with cramps after surgery
Yes,
any day
you put up
compared to
with
what
that.
was happening before,
And
right?
Yes, and you have such an awesome team with Dr. Hardee and Dr. Fox's team. They call constantly to check on you, see how you're doing. They lead you through everything. Do you need anything? Do you need any more pain medicine? So with their help and with the team help, you do get through with all the issues that you have going on after the surgery.
All right, who's the ideal patient?
Ideal patient is a lady aged 35 to 50 who no longer desires a future pregnancy, who has symptomatic fibroids. They have to have symptoms, either bleeding or pain or bulk-related symptoms. And ladies who really don't want to have surgery, don't want to miss downtime from work. And when we see patients in our office, we'll explain the procedure to them and then leave it up to them what's the best option for their individual case.
All right, so Dr. Hardee, thank you very much. And Bridget, you're all dressed up, and I say you go down to the bar down here at the Hotel Icon and have a good time. All right, Houston Fibroids, that's where you can get the help, HoustonFibroids.com, or you can call them at 713-575-3686, 713-575-3686. Get your life back. And speaking of, when we come back, pelvic floor disorder, we'll show you how to take care of that issue as well.